because mostly they're in denial. They're so used to taking care of other people, their only family members, and doing everything. When they have something that's sort of an aberration, they say, oh, it'll go away, this or that. And it's so important to listen, and that's part of my message out there, is to take charge of your own body, listen to your symptoms, because particularly, and fortunately, the doctors today are saying that women have different symptoms. Hello. This is the most wonderful thing that's happened. And we just tend to ignore. I was so confused by mine. One of the ones I had in the evening, after the day, I'd be sitting there and gee whiz, what have I, why is my back? So I'd get heat and put on heat, There we go again. And that's one of the symptoms. And it can be in the lower back, but women have strange symptoms, and we've all been listening to the traditional symptoms that men had for all these years. So that's why I'm out there beating my lips trying to get people to listen, and the women. And I was out to a golf course here recently, and the young woman who runs the cart there, I see her a lot, and so stopped and gave each other a big hug, and she said that she had been to her cardiologist and taken a stress test, and he said to her, well, this really looks okay, but because you're a woman, and I jumped off the ground and I said, we're there. The cardiologist said, because you're a woman, and this is so great. The cardiologist probably think I'm not supposed to feel that way, but it is. It's a known fact that women have not been addressed the same for their symptoms as the men. So I'm just saying the cardiologists are wonderful, because they're now paying attention and they're now addressing it.